Dear friends, did your doctor give you a statin and did you Google about the statin? Did the Google say your muscles will hurt, you will lose your muscles, your liver will get damaged, your memory will disappear? Please hold on. Before you panic, let's separate facts from myth because statins are some of the most studied medicines in the world and they help save millions of lives. Let's make statins super easy to understand in this video. I'm Dr. Gnanaraj. Welcome to DrLogic360 where we make medicine simple. Think of your arteries like pipes. Now imagine greasy junk building up inside those pipes. That's what the LDL cholesterol or the bad cholesterol does. Too much LDL cholesterol can lead to heart attacks and strokes. So how does statin help you here? They tell your liver, hey, slow down cholesterol production. They inhibit an enzyme making cholesterol in your liver. So less LDL cholesterol is produced in the liver, leading to less plaque formation and less chance of blockage. So now, who needs a statin? Doctors may prescribe statin if you have high bad cholesterol or the LDL cholesterol, or if you had a heart attack, or if you had a stroke, if you have diabetes, or if you have a stent in your arteries of the heart, or if you had a bypass surgery, or if your doctor thinks if your future risk of heart attack is high. Now let's meet the statins. The number one statin which is commonly prescribed is Atorvastatin, which is also called Lipitor. It is very powerful and supported by lots of research. You can take this any time of the day and it's a great choice for many patients. Then comes the Rosuvastatin, also called as Crestor. It is the strongest statin available. It's very powerful in lowering your LDL cholesterol and it has few drug interactions. Can also be taken any time of the day. So Atorvastatin and Rosuvastatin are the powerful statins available. Next comes the Simvastatin, which is an older statin. It's also called Zocor. It has helped many patients for decades. The only problem with Simvastatin is it has more medication interactions and it usually works best when taken at night. There are few other statins too, which includes Pravastatin. Think of Pravastatin as a gentle statin because it has fewer medicine interactions than the other statins. Doctors often consider Pravastatin when patients take many other medications. Then comes the Lovastatin, which is the very first statin approved in 1987. You could call it the grandfather of statins. It also can interact with other medications like Simvastatins. Then the Fluvastatin, which is also another gentle statin. It also avoids some of the common drug interactions. The last statin is the Pitavastatin. It is one of the newer statins. The unique feature of Pitavastatin is that it has less effect on your blood sugar than other statins. It is powerful at low doses and has relatively few drug interaction. So remember, every statin lowers LDL cholesterol to some extent. The most powerful are Atorvastatin and Rosuvastatin, and each has its own strengths and weakness. That's why the best statin is not the same for everyone. Now some cool facts. Atorvastatin and Rosuvastatin are the heavy lifters. They can lower your LDL or the bad cholesterol by more than 50%. Pravastatin is often called the gentle statin because it has very few drug interactions. Pitavastatin is interesting because studies have suggested it may not raise blood sugar the way other statin does. Let's talk about the scary stuff people read online about statins. Number one is the muscle pain. It is true that some people do get muscle aches with statins, but many people don't. Not every sore muscle is caused by a statin. Exercise, arthritis, dehydration, thyroid problems, vitamin deficiencies, all can cause muscle pain too. So it's not always the statin. Number 2 is liver damage. Statins rarely cause liver damage, but doctors still check frequently for liver damage by the statins. So you do not have to panic about liver damage from statins. Next one is the memory problems. A lot of scary stories exist online, but many claims are exaggerated. Research has not concluded that statin cause memory problems. Then the risk of diabetes. It is a fact that some statins can slightly increase your blood sugar, but for many high-risk patients, preventing a heart attack or a stroke is a much bigger benefit. Now let's see the biggest mistakes people make when taking statins. Mistake number 1. Many patients stop their statins when their cholesterol is better. Wait, the number may be better because the medicine is working. So please don't stop the statins. If you stop it, your cholesterol is going to go up high again. Mistake number 2. Taking it only when you remember. Statins work best when taken regularly. Mistake number 3. Blaming every ache in your body on the statins. Mistake number 4. Not telling your doctor about other medications or supplements that you are taking. Drug interactions matter, particularly when you are taking medications like Simvastatin. Mistake number 5. Thinking natural automatically means safer. That's not always true. So think twice before you take a natural supplement. Do your proper research. Let's wrap it up. Statins lower LDL cholesterol. They help reduce heart attack and stroke risk. Atorvastatin, Rosuvastatin and Simvastatin are the common choices. The best statin depends on the individual patients. Side effects can happen, but many people take statins safely for years. And one important rule, never stop your statin without talking to your doctor. If you found this video helpful, please subscribe to DrLogic360 and share with your friends and family. Thanks for watching. This is Dr. Gnanaraj signing off.